We're dealing mainly with people in all countries, high-income countries, low-income countries, who have mental illness. So it's a global problem because there's no country in the world where mental illness doesn't exist. I think it's been largely invisible. I think partly that's about the stigma that's been attached to mental illness over centuries, really. Most people with a mental disorder in most countries don't get treatment from a health professional, so that makes it more invisible. The Queensland Centre for Mental Health Research was actually started to try and improve what we knew about the best treatments for mental illness, and also to raise the profile for what could be done for people with mental illness in Queensland and Australia.
QSMHR is unique in Australia. We're really the only research institution of our kind in that we're funded by a government service and we partner directly with the University of Queensland.
We need the research of the university because really the health department's specialty is delivering care and the patients are there. The need for the research and the research excellence really comes from the university.
So my team here at QSMHR, we lead all the mental disorder estimates. We compile all the data, we do all the standardization of the data, all the modelling, and produce those estimates, and we're ultimately responsible for those estimates. And it's a very unique and very privileged opportunity to have. So the Global Burden of Disease Study is the largest scientific effort to quantify the prevalence and the burden of over 350 diseases and injuries all around the world, to provide policymakers, service planners, resource allocators, researchers, whoever needs these estimates, providing them these prevalence and burden estimates by age, by sex, by location, and by year, so they can make the most informed decisions as possible. So we quantify it using this metric called the disability adjusted life year. How many years of healthy life have you actually lost because of this disorder? Whether it's because you've died prematurely or you've lived with a particular condition for a number of years. Previously, we'd seen this occur in the middle age, but now this is the first time we're seeing with the most recent data that there's this spike in youth we weren't seeing before. I can't help but wonder if the cell phone use, social media increase, uptake, even for those that don't use social media on a day-to-day, how has its existence actually impacted the way we socially interact with each other as a society? On the horizon, they've got climate change and climate anxiety. They've got AI on the horizon. They don't know what they're going to do as a job. If they start a degree now, is it even going to exist?
Our evaluations is very much grounded in the consumer journey. So people who experience mental ill health, their carers and families, they're at the centre of what we do. We work with all of the stakeholders of those services, so not just people with lived experience, but the staff who do the work, psychologists, allied health professionals, psychiatrists, as well as the broader system folk. The recommendations of our crisis support space evaluation led to a $2.5 million injection of quality improvement funding for enabling the execution of work to respond to our recommendations, which is really exciting.
Our clinical trials is unique in the way that we deliver our service. We actually see them in their own home, we see them in their true life, so that makes a huge difference. The feedback that we get from consumers is, oh, nobody's ever asked me that question before, nobody has sat down with me and listened to my story, and they obviously feel comfortable enough to tell us their story and know that we are genuinely listening. They know that into the future that those results from clinical trials will make a difference to reduce the burden of illness, so they're more likely to engage.
Queensland Centre for Mental Health Research plays a vital role in training the future generation of mental health professionals. So many clinicians come through QSMHR and do their PhDs and commence a research career because they've been driven to do that because of clinical problems they're seeing every day in their practice.
The staff who work in mental health often didn't bother with a research higher degree, for example. Most of them now, most of the psychiatrists, for example, are interested in the public sector getting a research higher degree. So with that research knowledge and understanding they have, they are more aware of new treatments that are coming along. So I think the whole ecosystem that is mental health service system has been stimulated by having a strong research bent within it that feeds into clinicians and hospitals, into policy and into service planning.
People with lived experience have all the answers. We don't have to reinvent the wheel. What we need to be able to do is to make really compelling arguments for why things should be done in a certain way, to make that choice really easy. And that's what gives me hope.
Proof of the pudding, I guess, is in the eating of what it's produced.